Good afternoon, everyone. It's Mark Polenkars from the Rath Building with another COVID-19 update. We have not had one since Friday. We decided to go Monday, Wednesday, and Friday unless there was an emergency situation that required another one, but we did not have any real emergency situations this weekend, so I hope you all had a very good weekend. I'm here with Dr. Gail Burstein of the Erie County Department of Health, our Health Commissioner, as well as Kendra from Deaf Access Services to give you the latest update. I certainly thank everyone for following the social distancing guidelines. Most people have, and as a result, we've been able to stop the spread in the community and flatten the curve. We're not totally out of the woods yet, and we'll talk a little bit more about why we think that's the case, but we do appreciate everyone acting appropriately so that we can get through this coronavirus COVID-19 issue. As always, you'll be seeing the slides on the screen. It'll be talked about by both myself and Dr. Burstein. And as always, there's an important proviso. The information on the PowerPoint is current only as of the date of the presentation unless otherwise noted. And the situation does evolve rapidly at times. So what we're saying at this moment may change by the time we get back to our offices and get information. So we just want you to understand that for the most accurate information, you can always go to our website, www.erie.gov/COVID-19. We have a very important information to get out to the public regarding testing, as we've changed once again the availability of testing to individuals. And with that, I'll turn it over to our Health Commissioner, Dr. Gail Burstein.
Thank you. So I just want to let people know that we, as our community has expanded our capabilities for testing, that there are more tests available now. We have also expanded the people that are eligible for testing, because as a community we can do more testing. So now we are expanding our testing to any symptomatic individual, so regardless of where you work. If you have symptoms consistent with COVID-19, and I'll go over that just now, you are eligible to get tested. What we'll do is you have a healthcare provider, Kaleida will be able to test you, and if you do not have a healthcare provider, that is not a barrier to testing, and the Erie County Health Department will be able to test you. So again, anybody who has symptoms, regardless if you get tested or not, it's so important that you talk to your healthcare provider about your symptoms. If you do not have a healthcare provider, we have information on our COVID-19 website and in our hotline about different healthcare providers in our community that are still eager to accept new patients, and we highly encourage you to look at that list and contact a provider that is closest to you. Next. And so what are these symptoms of COVID-19? You know, it's basically a viral illness if you feel like viremic. So if you have a fever, cough, or shortness of breath, difficulty breathing, chills, shaking with the chills, muscle pain, headaches, sore throat, loss of taste or smell, those are symptoms now of COVID-19. And we know this because we have more experience of people in the United States being ill with COVID-19 and having more data of how they present. So it's really broadened the spectrum of what we know as COVID-19. So I just want to remind people, if you are tested for COVID-19, you must remain in isolation until you have your test results. Regardless of if your test results are positive or negative, until you receive those test results, that means that you are suspicious of having COVID-19. You are a PUI, person under investigation for COVID-19. So until we know that either you are not infected with COVID-19, until we know your test is negative, or if you're positive, until you meet the criteria to leave isolation, you must be in isolation. So
I just would add, that is not just for Erie County Public Health Lab tests. That's any test. Doesn't matter if you get tested by Erie County, Kaleida Health, the Quest test site that is at the Walmart. We had reports of individuals who went to the Quest site at the Walmart in Cheektowaga, and then they went inside and went shopping at Walmart. If you have symptoms of COVID-19 and you get tested, you are under an isolation order from Dr. Burstein, and you cannot go anywhere until you get your results. And I think people need to understand that. This is serious. So if you get tested, you shouldn't be bopping around town thinking like, well, I'll wait till get my test results to determine if I have it. If you've been tested, you have to stay home. Correct, doctor?
Yes, and in isolation within your home. And all the sites that are collecting specimens from people to send a test are legally obligated to give you access to those isolation orders, so you'll know what you have to do and you'll see the orders. So you could either, they may give you access by giving you a website where you can download and view the isolation orders, and let them know if you don't have access to that, because at that time, they're also legally obligated to give you paper copies, so you understand what the orders are, that you are under legal orders to remain in isolation for that whatever time period that is, and that you'll understand how to comply. So, again, if you go through and any of the testing centers and feel that you don't have the information around isolation, ask them. They're legally obligated to give them to you, and also that they may give you information on a piece of paper. You may not realize that's what it is, but that's what it is. So please read the piece of paper that they give you if you are tested, because it will give you all the information about isolation. So people are really worried that if they get a test and they think, well, I'm really sick and I'm really not sick enough to stay home. I can still work. I really have to earn money. So we don't want to cause harm in these in these really hard financial times. So I just want to let people know, while they're in isolation waiting to get a test, or while they're in late isolation because they have a positive test until they're released, they are eligible for paid leave, and that's if you're in isolation or in quarantine. And that's either for you, or if you have a minor child at home and you have to stay with them while they're in isolation or quarantine, you may be eligible for paid leave. And so you can get information about that, depending on your work situation. You could be eligible for either the federal paid leave through the U.S. Department of Labor, or the New York State paid leave for the New York State through New York State. And so you can go to those websites. Though that information is available on our Erie County Health Department website, or you could Google the U.S. Department of Labor or the New York State's COVID-19 site, and that'll give you the information. But you are eligible to receive payment if you are in isolation or quarantine, either yourself or your child, for COVID-19. So if people who want to get tested, because they know they'll still get an income if they are working, and they do have symptoms, they can do either of a couple things. They can either call us at 858-2929 and listen carefully for the options. Option 1 is just general questions from the public. Option 2 is if you have COVID-19 symptoms and you have a primary care provider, you'll be automatically put into the call queue with Kaleida Health, or you can directly go to Kaleida Health's website and register online for COVID-19 testing. Or option 3, if you have symptoms and you do not have a primary care provider, we can test you at the Erie County Health Department, and so you would stay with option 3. And option 4 is for healthcare providers that have any questions about COVID-19 testing at all, or any other type of questions.
Thank you, doctor. Want to inform folks that as of 12 p.m. today, there were 2,221 total positive cases for all labs. And when we say all labs, we're talking about every lab, because they're all required to provide their information to New York State. Goes into a state database, and then which we get the results. We do want to note there's one little anomaly that's popped up, and that we know that Quest Lab has been doing tests, because those are the ones who are responsible for doing tests at the Walmart site in Cheektowaga. However, for the last 4 days, we have not received a single report through the state system for Quest. So we are a little concerned that when Quest's next reports are actually put into the system, we're going to see some increases in the total positive cases and a big jump in numbers, especially considering we know they were doing a lot of tests at the Walmart site in Cheektowaga. So there are 2,221 total positive cases, all labs. That includes LabCorp, BioReference, the Erie County Department of Public Health Lab, Kaleida, Catholic Health, ECMC, But we do note that there seems to be a delay with regards to the Quest results. We do know there was a tremendous delay with regards to Quest getting testing done because they had so many samples that were going into their labs. The Quest lab that serves this area that does the analyzation is actually in the Pittsburgh area. So we do expect to see kind of a jump in these positive case numbers when the Quest numbers actually come in for these 4 days where we have nothing from them, but we know they were doing testing. 135 people have unfortunately died. These are all confirmed positive cases before death. There are no presumed positive cases listed here. This is 135 is the number we actually reported yesterday. We do not have a report through at least noon today of an additional death. That's a really good sign, but we had some pretty high jumps. It's 16 people on Saturday alone, and then there was another 4, I believe, on Sunday. So there are 20 people who perished over the weekend, and we do offer our deepest condolences to the friends and family of those who passed. Somebody that I previously honored as Senior of the Month, Chuck Big Wheelie Vicario, unfortunately passed from COVID-19, and offer my deepest condolences to his friends and family. Somebody that was well known in this park. It's a member of the Western New York and Buffalo Music Hall of Fame, so it's very sad that we lost Big Wheelie because he was a fighter. He actually went through a terrible motorcycle accident and was able to come back from that. So my deepest condolences is to his family, just like all the other families who've lost loved ones. Hospital reports as of the 18th, you can remember we're basically on a 2-day lag. There were 229 individuals who were hospitalized. Of those, 120 were in ICU, and 90 of those had an airway assist. As you will see in the next chart, we are a little concerned because we've been seeing a trend for the last few days of an increase in the ICU patients. And also, if you notice at the bottom of this chart, we've included the death data per day. It's a purple line at the bottom. And the reason we did that is we wanted to do a comparison of the days in which we had drops in the total admissions as well as ICU admissions compared to were there big increases in deaths on those days. And we added another line. How does it compare? Hospitalization number back up. You Are we back? Do we have sound?
We got sound.
I apologize for that, folks. There appears to have been a slight issue. Of course, we are always dealing with the best we can. So I just want to go back one chart. Talked about the 229 people that are hospitalized. Of those, 120 were in ICU, and 92 of those had an airway assist. And then we look at the chart that shows the hospitalizations. I was explaining, I think, when we lost the sound for a few moments there, that we have seen an increase in ICU patients over the last few days, but a decrease in intubations. Intubations may be decreasing because we're getting reports from hospitals that they're using alternative methods and they're saving the intubation, the ventilator, and for a last ditch, so to speak. They're trying other methods. But you see on the bottom of the chart, we've also included death data for that day from the hospitals. We wanted to do a comparison to see on some of those days where we had big drops in both hospitalization and ICU patients, was there a comparable drop or increase in deaths? And in some of those situations, you can see a direct correlation to a drop in overall admissions and ICUs with regards to deaths. This is something we're continuing to keep track of. Dr. Burstein, you want to talk a little bit more about why this is so important?
Yeah, so we are, again, as County Executive mentioned, we are keeping track of hospitalizations. And I know that people are thinking like, oh, we've reached a plateau and we're okay now, we can pull back on New York pause. But actually, I mean, these are high numbers and they're consistently high numbers. And you can see that the trend is increasing a little bit in the past couple days. So, we are not out of the woods. We are seeing consistently high numbers of people being admitted, people not only to the hospital, but also to the intensive care unit. And this is a chart looking at the number of daily admissions plus conversions of people who were COVID negative in the hospital becoming COVID positive in blue, and then the number of discharges per day in the hospital in red. And you can see that especially over the past 3 days, the blue line, the number of admissions and then new COVID-19 cases in the hospital, is much higher than the number of discharges in red. So again, we have to keep with our social distancing, we have to persist with wearing masks, we have to persist with staying away from people that are sick. So people that are sick, they have to stay away from other people, regardless of what illness you have, because we know COVID-19 can present in many different ways, and we have to persist in keeping our frequently touched surfaces clean and virus-free. So we are not out of the woods yet. We're still seeing consistently high number of admissions, and even recently an uptick to elevated numbers.
The next chart is a breakdown by gender and age through this morning's data, the 2,221 positive cases. This is not death, this is just the positive cases. 55% of all cases are female, 45% male. And the spread is not really that great when you're talking about the different age brackets from 20 to 29 up to 80 and above. A lot of people are saying, well, we just should keep all the old people home, the rest of us aren't going to get sick. Well, you can get sick. We've had individuals as young as between the age of 1 to 4. There's 2 males that have tested positive, as well as you see big jumps in the 20 to 29 and 30 to 39 over the younger, because we haven't tested that many teenagers, to be exact, but we have tested a lot of adults, because we're testing, and have been until at least today, we've been testing essential workers. Now that we're opening up to anyone who's symptomatic, we expect once again to see these trends continue, where it really doesn't matter which age or gender you are, you can get COVID-19. You're much more susceptible to a serious illness or death if you're older. But just because you're young doesn't mean you're invulnerable. We've been saying this all along, and I still can't believe there's people out there who think, hey, I'm young, I can do whatever I want, I'm not going to get sick. There are people who are young who've gotten sick in our community. And unfortunately, when it comes to fatalities, if you look at the next slide, the majority of those are older. 80 or above, or 48.9%, a little less than 50%, 20%, 21% or so, 70 to 79, but there have been individuals who perished in their 30s, in their 40s, and in their 50s. So we want people to understand that just because you're young doesn't mean that you are invulnerable to this. You can die from COVID-19. We've seen that here, and we've seen it elsewhere across the country. We've seen individuals who have no underlying health conditions that people know become very sick, and some die. So this is not a time to just say, lock up the old people and the rest of us can just go about our business. That is not the correct thing to talk about. And we'll talk a little bit about what we think is the appropriate time to start maybe rolling back some of the pause orders, but now is not it. And anybody who's going out there saying, Well, let's just lock up the old people because those are the ones who are really sick and dying from that. Go talk to a family member of somebody that lost a loved one who was in their 30s or 40s locally, or the younger ones that are dying elsewhere, and ask them what they think about that strategy. That is not a real strategy for a community that cares about each other. And then looking at the mortality data, remember, 55% of all positive cases in Erie County were females, but 58% of all deaths are males. And we believe that has to do with some of the comorbidity issues that males have, especially as they're older. Dr. Burstein, would you like to talk about that?
Sure. So it not only has to do with the higher mortality rate in males, not only has to do with comorbidities, it also has to do with smoking. So we know that there are more males that in general smoke compared to females. So so anybody who whether you have any type of comorbidities or not, we really have to adhere to this social distancing. Again, it's anybody can be affected.
Thank you. Then we have a breakdown with regards to the ethnicity, race. Once again, what we're seeing is as a percentage of the population, people of color are actually having more percentage of the deaths. African Americans make up approximately 14% of Erie County residents, but they're making up about 24% of deaths. We have seen a declination of that number from approximately a week ago when it was over 30 to 33%, so I'm glad to see that. But there's still a serious concern about people of color that when they receive this, if they're older, having a higher chance of death than a white person. I've been in touch and worked a lot over the last few days with our partners to increase testing across this community. We're also working with the Health Disparities Task Force and Kaleida Health to ensure that we're testing those that need to be tested throughout Erie County, as well as the city of Buffalo. And hopefully soon we'll have some very good information to talk about increased testing on the east side of Buffalo. Kaleida Health has a clinic right now that is on Best Street in the city of Buffalo, which is pretty centrally located. It's very close to Main Street. But that is for individuals who have a doctor's prescription and have a pre-appointment. But we do want people to understand there are testing sites in the city of Buffalo, just like the Erie County Department of Health testing site is a drive-through site in the town of Amherst. So we have some suburban sites across this community. We have sites in the city, and we're going to keep track of these numbers with regards to percentage of the population. We have right now 3% of the population that is passed that identify as Hispanic or Latino. That's a little less than the population of Hispanics and Latinos in Erie County. But remember, these are also self-reported numbers, so it may not 100% be accurate if the person's family was identified them not as Hispanic or Latino. But we're keeping track of these to ensure that we're addressing the need wherever it may be in the community. The COVID-19 maps, there's two big maps you should be paying attention to, the county's map and the state map. The state map is updated about once a day. The county's map is updated as needed during the day. As of when we set the PowerPoint up, that actually had not been updated to take into account the most recent positive cases and the increase in tests. We are roughly running at about a 24% testing ratio. So that means for every individual who is getting a test, and these are all up to this point symptomatic individuals, 24% of them are testing positive, which means they probably have something else. It just isn't COVID-19. We know there's a pretty bad bacterial infection and other types of bronchitis that's going around through the community. So just because someone's negative doesn't mean that they're not in great health. They may actually be in poor health, but at least they don't have COVID-19. But you can keep track of these maps. Of course, Erie County's map is at www.erie.gov/COVID-map. And you can check that out during the day. It's updated throughout the day. Erie County responds. Of course, we have a huge response even on the weekends. We were here, well, I wasn't here yesterday. Yesterday was my day off. I did take advantage of it, and I did something I needed to do in my house, which is some massive cleaning. But we were still here. Others were here. I think Dr. Burstein was here yesterday, and we were responding, of course. And one of the things that unfortunately we're seeing, once again, is an increase in overdoses as a result of people self-medicating with drugs. So I'm going to turn it over to Dr. Burstein to talk about why this is a huge concern.
Thanks. So unfortunately, you can see from this slide that we are seeing an increased number of non-fatal overdoses this year and fatal doses. So this is a slide showing at the by month the number of non-fatal overdoses in blue and fatal overdoses in red. So by January, February, March, and April. And so you can see that, and April is not over yet. So you can see that in so far this year we've had a significant number, a higher number than we had seen at the end of 2019 of non-fatal overdoses. And what's especially concerning is in March and so far in April, we've seen a very high number of fatal overdoses. So we haven't finished doing the tox tox screens on most of them yet. However, at the crime scenes, it's being reported to us that there's like a lot of white powder. So we suspect that there's a lot of cocaine that's laced with fentanyl out there, or maybe heroin laced with fentanyl out there. And then, unfortunately, people think that if they're using cocaine, they're not in trouble with overdosing from an opioid overdose. But you don't really know what it is. We're finding people that typically we haven't seen before, and so we think people are more likely to be at home and alone, and we're finding them dying home and alone. And so that's why we want people to know what resources are out there. First of all, we have a lot of Narcan still available for you. You can call our Erie County Health Department at 858-7695, and we can arrange for you to get Narcan. We know we're working with the Buffalo Police, and they're going out to sites, public sites, to food markets, to food pantries, to homeless shelters, to hotels, making sure that people have access to Narcan if they think that they need it. Also, please call our Crisis Services Addiction Hotline at 716-834-3131 if you want information or you want to be hooked up to a counselor. Remember, all the counseling services now are able to be obtained virtually, so you don't even have to leave your home. You can talk to a counselor online and establish a relationship online or just over the phone, not even with any video. Also, Buffalo Matters in our emergency department is starting people who are interested in starting on a Suboxone with low-dose Suboxone, and then hooking them up with a long-term provider to get a steady doses of Suboxone and get into treatment. So again, that is still working. And then there's a new app that's available that we want people to know about. It's called Never Use Alone. So you can search for it on the App Store and download it. So it's a combination of an app and a hotline. So if you have the app and you are about to use, you communicate that through the app. And then so the app will call that individual like 5 minutes after they report that they're using, making sure that they're okay, that they're still conscious. If they're not conscious, then they'll call 911. So this is something that is especially important for people that are using alone, because then you will never be alone. And that number also, if you want to contact them and let them know that you're about to use and you don't have the app, it's 800-484-3731. Again, it's 800-484-3731.
I would just note that the 716-834-3131 number is the Crisis Services Helpline. This is 24 helpline. The Crisis Services Addiction Hotline is 716-830-7007. So I just want to, there's a little error on the screen there. But the Crisis Services Helpline is 716-834-3131 for anyone who is just in a crisis situation. Know that you're not alone. We're here to help. And we have some new good news to talk about, and we want to thank New York State for. So, Dr. Burstein.
Sure. So we want to just shout out to New York State and give a big thanks. We have new equipment in our public health lab that is allowing us to perform labs more efficiently for COVID-19. So we'll be able to do more tests per day, and that we also have more reagents. So we really want to thank them for that. Also, they've been supplying us with a good, steady state of specimen collection swabs so that we're able to test people. And then also they've been really great with providing us with personal protective equipment for us to give to the local hospitals, nursing homes, and our first responders. So we really want to thank New York State for those great assets. And then also we want to give a big shout out to HealthyLink. HealthyLink is our health information technology resource. So they've been great in providing us much of the data that we've been able to show you. So they've been helping us making sure that we have all the lab reports, the comorbidities with the people that test positive, and then also with the people that unfortunately succumb. And then they're really our big resource for getting population health data. So we just want to call out HealthyLink for really helping us look at our epidemic in Erie County.
Of course, the information regarding our our COVID-19 call center, the menu has changed, as Dr. Burstein noted earlier. So I'd ask you to call the hotline at 858-2929, but know that the menu has changed depending on whether you are an individual who's who's got symptomatic, who's seeking to be tested, that has a prescription, or a doctor, a personal care physician, as compared to someone who doesn't, as compared to just a general question, and then healthcare providers, which have a separate option on the phone. So make certain that you hit the right option so you're switched to the right individual at our call center. Call centers from 8 to 8. Do not ask hypothetical questions if you're asking for questions on our call center staff. They are generally busy. There are times that are a little slower than others. I fully expect that if you see this, a lot of people are starting to call right now, and then the call center is going to be pretty busy. We answer every call, and it's answered right here in downtown Buffalo. It's not going to a call center elsewhere. It's going to somebody that is working right now for our Erie County Department of Health staff. And then, of course, online, lots of information online, including the county's website at www.erie.gov/COVID-19, the New York State, as well as the federal hotlines and websites, which, of course, the CDC one's a very important one with accurate information, and that's coronavirus.gov. With that, we'll open up the phone lines to take some questions from the media. But before then, I just want to note that there's a lot of folks that are thinking it may be time to reopen. And one of the things that I want to let the public know is, based on the numbers that we've seen, we are not New York City, and we're not doing comparisons with New York City, but we are also not ready to just open everything. We are seeing increases in ICU units. We are seeing, while if it's not a plateauing, we're seeing a steadying of the, we're seeing a steadying of the cases that are in hospitals, and we are seeing the last few days more people that are admitted to hospital than discharged. So I know there's a lot of folks out there who are saying just open up. We are not ready for that. As we showed you the data last week, we're a smaller community as a county compared to Allegheny County, Pennsylvania, where Pittsburgh is, and Cuyahoga County, Ohio, where Cleveland is, yet we have more cases and more deaths. I would hope that we're getting better, but until we have more data, and as I said last week, by the end of this upcoming week, we should have much more better data to understand what's going on. There's a lot of questions as to how we would reopen. The data that we have is being shared with New York State, and we are providing that information to Governor Cuomo and his staff, so they're fully aware of our situation here. I think they agree with us that while it's better than downstate, of course, we are still not out of the woods yet, and therefore we're going to be taking appropriate action for the time being. And when we do think it's time to make some changes, it will not be all at once. It will be a phased-in approach. The president announced a three-step phased-in approach. I witnessed that press conference. I actually thought that the steps were probably appropriate to think about, but we're not at that point yet where we need to move to phase one. Until we've got better hospitalization data that shows that our hospitalizations, our ICU numbers, or so forth, are going down, while we've flattened the curve and we've reduced the spread, we've not reached a point where we feel we can just open up our region again. And that's why we are continuing to take the actions that we're taking. So with that, I'll open it up to our friends in the media, and we'll start at the top today. Once again, anybody there from B News? If not B News, anybody from Buffalo Business First? If not Buffalo Business
Yes,
First?
hi.
Oh, we have someone from Buffalo Business First? How about the Buffalo News? Phil Fairbanks.
Yeah, thank you. I'm sorry I chimed in there too early. Listen, a two-part question for both of you. Given the absence of widespread testing, especially early on in the crisis, is there a likelihood here that deaths are being underreported? And second, for families who may have lost a loved one they believe to COVID-19, can they take a sample now and have their loved one tested down the road when tests more available?
I'm going to turn this over to Dr. Burstein. I'm not the right person to ask that question to.
Sure. Well, even though we haven't had widespread community testing from COVID-19, we know that the hospitals have been very aggressive about testing patients that they're specific of COVID-19. So all those who were very ill in the hospital who were identified with COVID-19 if they were infected. So those individuals were, were identified. For people that unfortunately died at home and there's a history of a suspicion of COVID-19, the person's physician would sign that death certificate. So the death certificates now there's been a revision. So there's a place where the physician can list suspicious or confirmed COVID-19 as a cause or one of the causes of death. So those data are being captured because, again, suspicious COVID-19 is a possibility as a cause of death in New York State.
Okay, thank you. Investigative Post, anybody from Investigative Post? If not, Spectrum News, Aaron?
Yeah, hi, Mark. Just wanted to ask you and probably Dr. Burstein, what is the testing for antibody testing at Wegmans mean for this?
The issue of the New York State Department of Health is doing random tests across upstate and downstate New York of antibody testing. The Wegmans testing, we hear they are testing at the Wegmans on Amherst Street in the city of Buffalo and Alberta Drive in Amherst. Those are random tests. People, I believe, are not just showing up and getting tested. They're actually asking individuals in the store, and they're doing about 100 a day. That test material is then being sent back to Albany. It is not being done by the New York State, or excuse me, the Erie County Department of Health. It's being done by the New York State Department of Health. We have on order over $1 million worth of testing equipment and supplies from Abbott Laboratories, and we're hopeful that we'll have that very soon. But we don't have it yet. So the antibody test that is being done at the Wegmans in Erie County is being done by the New York State Department of Health as a randomized sample. Once again, if you're not on the phone, can you please mute your phone because we're getting some background noise? So the New York State Department of Health that is doing the tests at Wegmans is doing a randomized sample to try to get a good idea of what's going on in each community, but they are not doing mass testing either. And that is to give them an idea of what's going on statewide with regards to if you test positive with an antibody test, that means you were exposed and had it even if you didn't know it. And they want to get an idea of what the percentage of the population might be.
And then, I know that some commercial laboratories already have antibody testing available. For example, Quest has informed us that they have antibody testing available. But then, I just want to caution people about how to interpret results if they're positive. So right now, New York State Health Department and CDC are advising that people that have a positive COVID-19 antibody test means that they were exposed. We can't say definitively that there is any level of antibody protection, and we can't say definitively if there is antibody detection or protection, how long that would last. So right now, all we can really confidently say until we have more science to inform us that an antibody test means that somebody was in contact with COVID-19 and probably infected regardless of if they had symptoms. So it really is, at this point, providing us with limited information.
Thank you. WBEN, Tim Wenger.
Hey, Mark, thank you for taking the questions today. I know you looked out on the protest today down in Niagara Square. Just thoughts on what the messaging was. Do you think it's mixed messaging? What are your feelings on the fact that people chose to rally in Niagara Square today for that purpose?
Well, I mean, I certainly understand the disappointment that people have. Some of them have lost jobs. I understand that. But we're not out of the woods yet. We are not New York City. I agree with some of the protesters who felt that way, but we are not in a place where we can just open up. We would certainly be in a much worse situation because we would lose the flattening of the curve. There were about 150 vehicles is what have been reported to me by our Central Police Service Commissioner, Jim Jansowitz, as counted by the Buffalo Police. I looked over it, took a photo. I certainly understand why people protest, and I think it's premature for them to protest right now. If you saw my tweet, I called the one individual a ding-dong, and people are like, why did you do that? Well, they had a Confederate battle flag on the back of their vehicle, as well as an American flag. Last time I checked, the Confederates are the ones that were shooting at the Union troops, and I think everyone knows that a Confederate flag is really a flag that is dealing with racial subjugation. It's not a states' rights issue, folks. The Confederate flag is the flag of slavery and the flag of racism. I probably should have used a harsher word than calling the individual a ding-dong, but that's what I did. So I understand why some people are upset, but if they want to take their racism, take it out of this community. I don't want it here. We don't need it. It's one thing to be able to go out there and protest about whether we're going to open up yet. I understand why people are upset, but we have not reached a point where we should be able to open up this week. Maybe even next week. We'll look at it in the long run. We know it's going to take some time. We are certainly analyzing it. I have no interest on doing this every day and dealing with this every day. And I know the doctor feels the same way. We've been working very hard, like our staff has been working very hard, and we'd like to go back to normal circumstances. But we can't go back to just opening everything up until we know it's safe for the general public. Mike Desmond, WBFO.
Yeah, two questions that are somewhat related.
Yes, Michael. Are you there?
Yeah, I'm trying to.
I hear you. Go ahead. Go ahead.
Okay. Two related questions. Statistically, how many antibody tests do you have to have any meaningful results? And second, can you take samples of someone who dies and it may or may not be COVID and test them later because there's such a shortage of testing material?
Well, I'll answer the first question. We've actually have an order for 100,000 sample kits, so to speak, for the antibody testing. We are not going low. We're not just going to test 50 to 100. When we get the antibody test, we want to test a sizable amount of the population, and 100,000 would be about 10% of the population. So we're going to try to test as many people as we can once we get the antibody kits. They're not going to be able to test them all at once because there's only so many that you can analyze in a day, but we're going to test a lot in a fairly short period of time once we have it. And I'll turn the other portion of the question over to Dr. Burstein regarding the additional testing that Michael asked about.
Sure. Well, there would really be, a question with the family of the deceased and the provider of the deceased. If there was blood taken just before or around the time of death, and it was stored, that could be appropriately, like frozen. There could be testing done, post-mortem. However, once it's not really clear. I'm not sure if we know how long the virus would be detectable after a person dies, and how long the antibody would be detectable after a person dies.
Earlier,
go ahead, Michael.
you said earlier that there are no presumed deaths here the way they have had in New York.
That is correct. Every individual who has been listed as a death has tested positive for COVID-19 while they were alive. So New York City has some presumed deaths based on the evidence, but they had not actually performed a test on that individual. We have not done that with the deaths listed here. some people who are trying to get information out there on social media saying that all the deaths are the 135 that we have, they're not COVID-19 deaths. Those individuals who tested positive for COVID-19 while they were alive, and they died as a result of contracting the illness. Now, I am aware of a few individuals who had tested positive for COVID-19 who died from other circumstances, including some late-stage cancer. Those were not included in the death totals here because it was determined that they died from the late-stage cancer, not COVID-19. So we wanted to provide the most accurate information we could to the public about where we stand with these deaths. So there are no presumed positives in the deaths, and there are some people who have contracted COVID-19 who actually have died, but because the determination of death was they died from their late-stage cancer, not COVID-19, those are not included in the 135.
And then just to clarify, with if a private provider decides that on the death certificate of a patient that died of a natural cause had to be related to COVID-19, that can be listed on the death certificate, and that those data would go up to the state. And then when they report their death statistics, in a year or two later, that might be included. But again, we're looking at data of people that have had positive test results that have been reported to the New York State Department of Health.
Thank you, Doctor. Next up is WGRZ, Emily Watkins, maybe David McKinley. WGRZ?
Yes, hello.
Go ahead, Dave.
Oh, thank you very much, Mr. Executive. Two-part question for you. Now, you just mentioned the antibody tests that you have on order. The state is conducting 3,000 of these. You say you've ordered 100,000. Any idea, though, when you might be able to get that many?
We're hoping soon. Doctor, would you like to answer that question?
Sure. So the test that we have ordered is manufactured by Abbott, and so we have that on order along with an additional equipment and to add to the equipment that we have to conduct that test. Currently, that test has not been approved by FDA. Abbott tells us that they expect an approval by FDA under the Emergency Use Authorization Act. And so we're hoping by the end of the week we'll be able to start to roll that out. But again, we are also, that's buying us time to guidance from the New York State Health Department about priority of who to test if they are going to issue any, and then also about the language about how to inform people with a positive test result about what we can interpret with those data. So again, an antibody testing is one tool. It doesn't tell you if somebody at that point in time is infected with COVID-19. It's not a diagnostic test. Right now, all that we know that it's telling us is that somebody who has a positive antibody test has been exposed to COVID-19 and likely has been infected.
And Dr. Burst, well, you'd mentioned right at the top of today's presentation that you were expanding the criteria to get a COVID-19 test. But if I'm understanding that correctly, how do you then get it? Do you still need to call your first, or do you call the health department, or do you show up someplace? How would you get it?
Well, first of all the tests are by appointment only. If somebody is symptomatic, regardless of if they're employed or not or where they're employed, if they do not have a primary care provider, they can call the Erie County Health Department at 858-2929 and press and then listen to the options, and then press the option that said you are symptomatic and you want to test and you don't have a primary care provider. If you do have a primary care provider, Kaleida Health, who's been a great partner in community testing, will also test anybody with a primary care provider and with a prescription for COVID-19 testing who is symptomatic. Again, you can go right to the Kaleida Health's website and register for an appointment for a test, or you can call the Erie County Health Department and we will connect you with Kaleida to make an appointment for that test. And again, right now those are polymerase chain reaction test, diagnostic molecular testing, and so that will tell you at this point in time if you are infected with COVID-19 as opposed to the antibody tests.
Thank you.
Thank you. WIVB, Marley Tuskus.
Yes, hi, Mark. So I wanted to discuss, you had tweeted earlier that there was a bar that opened for a secret happy hour. You were going to discuss more during your 2:30 press conference. I'm wondering if you could provide any more details on that, as well as reflect how many tips that the county has received about different bars and restaurants that have not been complying with the pause order.
We have received quite a number of tips. They come in and are then have our Department of Health go out. The Department of Health issued a commissioner's order to shut down Gables on Hurdle Avenue in Buffalo after it appears they were having an unofficial happy hour. I'll turn it over to Dr. Burstein to talk more, but that information, of course, will be now transmitted to the New York State Liquor Authority. I don't know why any bar would do this, as the two earlier bars found out. Once the information was turned over to the State Liquor Authority, their liquor license was suspended. So maybe they think they can get away with it, but we're getting lots of calls into our call center with regards to bars that are operating illegally. You can call them speakeasies, or they're having unofficial happy hours. And someone who lived in the neighborhood near Gables called and said they're doing this every day. We had one of our Department of Health sanitarians go out undercover, determine that to be correct, and an issue shutting them down was issued by the Department of Health. Dr. Burstein, you want to talk a little bit more about the process?
Sure. So when we receive a tip, we follow up. Many times the tip does really, people see cars in the parking lot, and it's people waiting to get their takeout, and cars from employees that are working in the kitchen. However, in this instance, the tip was accurate, and they were serving, Gables was serving alcohol on the premises. So our sanitarians were deployed there, investigated. They discovered that there was service of customers inside the facility, and so they came in with our Erie County sheriffs, cleared the house, and were issued an order for me to close. And they were reported to the New York State Liquor Authority with this violation, and then also we asked the restaurant to deliver to us a plan that we have to approve to tell us how are they going to prevent this from recurring, and what new policies they will be putting in place to ensure that they only provide any type of safe takeout service. And our sanitarians will review that plan when we receive it, and only then will we permit them to reopen for takeout service only. And we will do this with any bar or restaurant that we find serving food to people or beverages to people on the premises.
Yes, remember, the issue is they can do takeout, and they can do takeout of alcohol too under the governor's pause order, but if they're serving people at the bar who are drinking at the bar, they're violating the law. They're violating the executive order, and they can be shut down. Next question to WKBW, Jeff Russo.
Yes, good afternoon, Mark. Hello, Dr. Burstein. I know you pointed, I'm looking back at my notes, I know you pointed back on Friday that the models in terms of that you were looking at in terms of Erie County, the peak for us in terms of cases and perhaps deaths was still a couple weeks away, several weeks away. I think you pointed to mid-May. One, is that still accurate in terms of the information you have and the models that you're looking at? And with you saying that we're not out of the woods yet, which is clear, are there challenges in that message, though, in some ways, when we have Governor Cuomo saying New York is over its peak in terms of perhaps fatalities and deaths, in terms of the message you're trying to get across for our area?
Sure. So I spoke with Dr. Winkelstein this morning, and from the University of Buffalo Jacobs School of Medicine, and he is going to be releasing, showing us an updated model with updated data that's really showing the success of our social distancing. And so what I expect to see is the the curve continuing to flatten, be smushed, and spread out. So we're waiting to see what that is. So really, Because we have not had this super huge peak yet is really because of all the social distancing that we've been doing in the community. Really, everybody counts, everybody's action counts, and what we do today will determine where we are a week from now in terms of our peak or plateau. So it's very important to continue to keep this peak up. Again, you saw the hospital data. Even though it's we're not seeing a very steep incline like we did with the hospitals before we instituted social distancing. Remember at the beginning of the curve, before we had the New York pause, or the very beginning of the New York pause, we had a steep increase of number of admissions, and now we're flattening out more. And even when we do see an increase, it's not huge. It's because of our social distancing, and anytime we let up for that, we are going to see the effects of increased number of people getting ill and going to the hospital. So it's really important that we continue with that. So, again, we don't have any information that shows that we're on the decline, and that's where we'd want to see where we start to consider even slowly pushing back on New York pause as the Governor Cuomo permits.
The one thing I would note is, Jeff, if I just say, the one thing I would note is anytime we were talking about flattening the curve is much longer. When you don't have a flattened curve, you have a peak, shoots up, and then it goes down. When you flatten the curve, you're, as the Dr. Burstein likes to talk about, smushing it. It's taking a longer period to get through it. So we don't know if we're nearing our peak, we're still away from the peak. The models that we've looked at have shown us a number of weeks away from the peak. We are happy to see that the people, by staying home and stopping the spread of the coronavirus, is helping to reduce the number of hospitalizations in total. But our hospitalizations have been staying pretty static as a number, and as we said, we've seen increases in ICU over the last few days. So that gives us concern. I am in contact with the leadership of hospitals, the hospital systems, to see how they feel with regards to how things are going at their hospitals. And I think they all feel the same. We're glad we're not seeing this huge increase in hospital admissions, but we're not out of the woods yet, as I've said. When that's going to be, I think that's a problem to say exactly when, until we have additional data that shows that we are declining in hospitalizations, declining in ICUs, declining in deaths. Declining in deaths is a good thing unless you see a huge increase in hospitalizations. A decrease in hospitalizations may be good, but as we showed earlier, if it coincides with a lot of deaths that day, that just tells us that we're not seeing the trend line we'd like to see. Dr. Winkelstein's model from UB has been very helpful to give us an idea of what we need to know and expect. Any model is just that. It's not a model. It's not 100% correct. The Buffalo News reported yesterday that a professor, I believe out of RPI, predicted that we wouldn't reach our peak until June. Is that accurate? I don't know, maybe. We're just going to have to keep on looking at the data and the hard data to make a better determination of what's going on.
It's these predictions are like the weather. So the farther out you're trying to predict the weather, the less accurate you're going to be, and it's true with these models too. So again, these are just estimations. But what we know now, we're not in a place to really pull back on our social isolation or social distancing.
Did you have a follow-up, Jeff?
For sure, yeah. Yeah, I think that's understood in terms of a ways to go before you relax that part of it. I believe you've noted over the last week or so, or a couple of weeks, that your thoughts were we would always be behind any peak for New York City or other parts of the state. Is that still consistent with your thinking? That even if they say the state perhaps is over or the plateau is over, that we may be behind, is that still considered accurate?
Correct. And I think people need to understand that while we don't compare with New York City in scope and size, we also have a different timeline of when the coronavirus entered our community. Western New York was one of the last to have confirmed cases. And as a result, we are going to be one of the last to get to our peak and then on the downward trend. The models are all based on what happened elsewhere, how long it took from the first positive case to the first death, to the 10th death, and so on. And then you base it, an examination of it, on the population in the community. So that's how you can have and do sort of a comparison on timelines, even if the numbers are completely different, because you're looking at the per capita amount of cases, the per capita amount of deaths, as compared to just the raw numbers. That's why we're very concerned about what we saw when we looked at the Pittsburgh and Cleveland numbers, the Cuyahoga County and the Allegheny County numbers, because those counties both have 300,000 more people in them, but we have more cases and more deaths, and when it compares to the one county, Allegheny County, we've tested less people. So per capita, Erie County has more tests and deaths, or positive tests and deaths, compared to Pittsburgh. So that's why you have to look at it in some ways on a regional by regional basis. I understand what some of the protesters were saying. We can't treat everyone the same, and that's correct. But you have to go with the raw data and the actual data you have. And while New York State maybe has reached its peak, we don't believe we've reached our peak. And New York State's peak is always going to be in some ways skewed because of what you see downstate with thousands and thousands of people who died. So we're not at the same place yet. Okay, going back to the top. You're welcome. Phil Fairbanks, the Buffalo News, are you still on? Phil, are you still on?
I am. I'm still here. Yeah, can I just revisit the issue of underreporting for a moment? I'm curious whether either of you think that there is potential for serious underreporting here.
I really can't answer that question. We'd have to look at the data to see are there many other deaths that are going on in the community that are not being identified as COVID-19 deaths. I do know that there are less people that are going to the hospital in general, and that's a good thing. But we don't know if that means, like you're seeing in New York City, that people are staying home when they probably should have been hospitalized. We don't think we have that problem here, but it's tough to say. Dr. Burstein?
Sure. I mean, just in terms of the confirmed laboratory results, we know that we have in New York State a really tight surveillance system. So any laboratory that's licensed to test people in New York State has to participate in New York State's electronic clinical laboratory reporting system, or ECLAIRS for short. So when there is a positive test for a reportable disease, that automatically gets sent to the state. At the same time, it gets sent to the ordering physician, and then so the state collects all those data. So we know that we feel pretty confident that everybody who has a test for COVID-19, a laboratory test for COVID-19 that was positive is received to the state and then transmitted to us. So just in terms of the laboratory confirmed testing, we know that we are capturing all those, and then working with HealthyLink, we're ensuring that all those who tested positive, who unfortunately had deceased, are also being captured in our data set.
Does that answer your question, Phil?
Yeah, well, I'm thinking of folks who died at home who probably were not tested. I mean, do you think there are large numbers of those or not?
I don't have a reason to believe there's large numbers. Has it happened? It may have happened. Okay. But I don't have a reason to believe there's large numbers of it.
Okay.
Okay, Aaron from Spectrum?
Yeah, so I know we're not ready to reopen yet, but the governor did mention earlier that it's more likely to happen on a regional base than a county by county or necessarily an entire state. Has the state been in contact with any of the Western New York counties about working together on that?
Well, I've had conversations with members of the state administration. It's not surprising for them to say it. I think we know that you're just not going to do a county by county reopening. It's going to have to be based on Western New York, Finger Lakes, Hudson Valley, Long Island. So I think it's fair to say that hearing that from the governor today was no surprise, because it's kind of a conversation I've had behind the scenes. But at this point, we're just working with the state to give them the accurate information, because in the end, it's also going to be the state that's going to make the call. Remember, New York State Governor Andrew Cuomo, in his order, is basically prohibiting local governments from doing orders that are not acceptable to New York State. So if the governor or New York State Department of Health don't like the idea that you have, they're not going to allow you to do it. So we need to have their support, and we also need them to say, yes, we agree with you, it's time to reopen before there's going to be any reopening. I could not reopen Erie County on my own. The orders that are in place are primarily gubernatorial orders. We have a number of executive orders in place that are county-based, all of them having received the approval from New York State, but the pause orders are statewide orders. And so it's going to require the state to lift those orders, even if it's on a region-by-region basis. I cannot lift them myself. Tim from WBEN, any other questions if you're still on?
Just real clarification, perhaps, from Dr. Burstein on the symptoms and the expanded testing. Is there any concern that you're just going to overwhelm the testing that might be available with people that, may have symptoms that are something else? Or, is that a good thing? As you've noted, you can have just a couple of these symptoms and be COVID-19 positive. Just comments on what symptoms should be most concerning for someone to step forward and say, I need testing.
Well, that's a great question. So the presentation of COVID-19 we know is very variable, and there are people that don't have any symptoms, people with mild symptoms, and then people that are so ill they require hospitalization. So, right now we don't have enough information to say to only limit testing to one spectrum of symptoms. And so we know that in our community, thanks to Kaleid's increased capacity and our public health labs increased capacity, we're able to do more tests than we're currently doing. So we thought that now we believe that we have the capacity to open it up to anybody that's symptomatic. If that turns out that we're overwhelmed, we could always push back, but we feel pretty confident we do have the capacity to test all those are symptomatic. And remember, there are consequences. So people that are symptomatic and they're concerned enough to get tested, they need to remain in isolation until they have a negative test result, or if they have a positive test result, until they meet the criteria from being released for isolation. So again, this is part of our public health strategy to identify people that are infected with COVID-19, remove them from possibility of community transmission, and hopefully, get our curve to a place where we're able to put back. So again, we want to use this as a tool to help us eventually get to a place where the numbers are coming down. So that would be identifying anybody that is positive for COVID-19, and we know they're most likely to have people who have any type of symptoms, and then making sure that they're isolated to prevent transmission. So this is, again, another tool that we have working with our community partner, Kaleida Health, to identify people that are positive.
Thank you. Mike Desmond, are you still on from WBFO?
There we go. You talked weeks ago about all of these masks that the county was bringing in from some far distance. Did you ever get them?
The orders from outside the United States were pretty much all canceled without the county paying any money. We are still in the process of receiving PPEs. We've had some PPEs come in that we've ordered. We actually have if it goes well, a larger order that'll be received in the next few days. It could be as soon as tomorrow, maybe Wednesday. But the original orders from most of the Chinese and Taiwanese and other manufacturers all turned out to be no good. But one of the good things that we did compared to other areas is we did not give them money up front. So we weren't out money for orders that would never come in. Everyone's in the same boat on this one. We're all fighting for PPEs, but I am glad to say that it appears that the American manufacturers have been able to ramp up production, and those PPEs are starting to get out the door. WGRZ, Channel 2, Dave McKinley, Emily Watkins. Any other questions?
Hi, County Executive. I have a question for the doctor about, you discussed the alternatives to intubation that are being used in order to conserve that as a last resort measure. Could you explain some of those methods that are being used by local hospitals?
Sure. One example is to use peak, high flow oxygen, into the nose instead of intubating somebody. Making sure that posture is maximized to increase airway flow. So those are a couple different examples, but I encourage you to talk to the hospitals themselves to ask them what specific strategies that they're using to try to avoid intubation when possible.
Thank you. Marley Tuskies, WIVB. Marley, are you still on? If not, Jeff, are you still on from WKBW?
I am, but I'm all set. Thank you, guys.
Okay, I believe we also have Sandra Tan from the Buffalo News, a late caller. Sandra, welcome back.
Yes, thanks. I had just two quick questions. One is about the public health lab now has new equipment, as you mentioned earlier today. I'm wondering how many tests that will now allow the public health lab to do in a day. I know it used to be around 100. And my other data-related question was, I was interested in your overdose, I don't know step numbers, and I wondered if you had comparative information for March and April of last year.
We could get you the comparative information for last year. I don't think either of us have it at the ready right now. However, I believe Dr. Burstein can answer the first question with regards to how much more can be done at the public health lab as a result of receiving the new information from New York State. Dr. Burstein?
Sure. Well, and then just getting back to the to overdoses, just remember the caveat is most of them are still suspected and they haven't been confirmed by toxicology. So the where we are now is with all the suspected cases, we don't know that they are really going to end up being overdoses. So there's really a limited amount that we can say about that. Although we would be happy to provide you with the data. Just remember that most of them are unconfirmed, and so we can't tell you at that point in time what's going to be positive and what isn't. And then in terms of the testing, before we were able to do about 80 up to 80 tests a day. Right now, we just have this acquired this new technology, and we're probably able to do maybe 100 or 120 a day. So we have to get more comfortable with this new automated system and work the flow. But we again we are expanding our testing capacity. Again with our partners in Kaleida Health. So overall as a community, there is much more testing available for people with the molecular diagnostic testing.
Thank you.
Thank you.
Okay. If there are no further questions, we will wrap up the presentation for the day. I want to thank everyone for their good work in helping to reduce the spread of the coronavirus across Erie County. One of the reasons why we've seen the flattening of the curve, so to speak, is because people have been following the SMART guidelines that we have regarding social distancing, avoiding the physical distancing, or I should say the physical closeness issues that often can cause the spread of the coronavirus. I want to remind everybody we are still under the governor's orders to wear our masks. I have my mask of the day here. I don't use the same mask every day. I've had a bunch of them that are cloth and some that are just procedural masks. Basically, if I got a cloth mask, I wash this every day. I don't use it day in and day out. We still need to follow those, and I want everyone to understand that we are under a gubernatorial order for that. So please do that as well. I thank everybody for their continued good work. We are not out of the woods yet. That's basically the message of the day. I know there's a lot of folks that are frustrated. They wish we could get back to normal. I wish we could get back to normal. I'd like to get a haircut. My hair is getting pretty long. I was playing with this hairstyle over the weekend. Had it fluffed up in front and looked like something I haven't looked like since high school. I don't know if I'll bring that out for the public use or not, but let's just put it this way. I'd like to be able to get a haircut just like a lot of other people would like to be able to get a haircut. And I'd like to be able to go back to normal times as well, but we're not there yet. We still know we have some increasing hospitalization with regards to ICU. Our deaths, we had 20 deaths this weekend. And I want people to remember that these are not just numbers. These are people, these are fathers, these are mothers, these are grandparents, these are sons and daughters, aunts and uncles. And to each and every one of those who lost a loved one, you have my deepest condolences and sympathies. I know people who are ill. To Tonawanda Supervisor Joe Eminger, we want you back on the road to recovery as quickly as possible. I know he had a little setback this weekend. He posted it on social media that he had to go to the hospital. He's got pneumonia. Well, I want to let Joe know we're all pulling for you as well. This is real. This is serious. We're not out of the woods yet. And if we feel that we are trending in the right direction, we will say so publicly, because we want the public to know where we feel we are. But until we are at that point, we need to continue to follow proper social distancing guidelines, and together we will get through this. We are in this together. We are our brothers and sisters' keeper. I wear my mask to protect you and myself, and I need you to wear your mask to protect me and yourself. So with that, I hope that everyone has a wonderful day, and does what's necessary to continue to ensure that we all of us, we the people of Erie County and Western New York, get through this as best as possible. And that's why I say to you, be safe, be well. Until I see you again next time, I'm going to put my mask on. Take care, everyone.